The shutdown is entering day 26. No deal in sight to end this shutdown. There are concerns over how the shutdown is affecting health care in America, though. A main issue is food safety, since the Food and Drug Administration is overseen by the Department of Health and Human Services. Joining me right now is Health and Human Services Secretary Alex Azar. Secretary Azar, it's good to have you on the program this morning. Thanks very much for joining us.
Good morning, Maria.
What has been the impact so far to this shutdown?
Well, the president's been absolutely resolute that we've got to solve this border security crisis, and the American people have demanded that of us. And the rest of us are working to ensure that the shutdown, any impact is mitigated on individuals. So, for instance, at the FDA, we have called back food inspectors to help ensure inspection of the highest risk products, as well as our medical inspectors for medical products there. And we're very grateful to those individuals for coming back to work.
Yeah, you could call back. I mean, the IRS is calling back people ahead of the tax return season. You're calling back food inspectors. How long can you do that, right? I mean, at some point, these people are facing no paychecks. These people are really taking the brunt of what has been a digging in on both sides. So what's plan B if this continues?
We're just going to keep working to mitigate any impact on the American people. We have the ability to continue to function to protect the health, safety, and national security of the United States. And we're just very grateful to the employees of the FDA and the Indian Health Service for continuing to work in the very important public health mission that we've got here. The rest of our department here at HHS was actually funded before the end of the fiscal year. So it's really at FDA and the Indian Health Service that our biggest impacts are happening.
And have you seen any impacts yet? Given the fact that we are in day 26?
I have not yet, but we're doing everything we can to mitigate any impacts.
All right. Let me ask you about drug prices, because this has been obviously a priority for you. Big pharma companies on the decline recently after House Democrats announced an investigation into the high price of prescription drugs. House Oversight and Reform Committee Chair Elijah Cummings says he sent letters to 12 major drug makers. Secretary, you met with Congressman Cummings yesterday. You tweeted about your meeting saying that you're willing to work with Democrats and Republicans on reducing drug costs for Americans. How will you do that?
So I had a great meeting with Chairman Cummings yesterday, and we really appreciate his call and continued attention to this issue of drug pricing. We've made real progress here. We've got historic levels of generic drug approvals that have saved the consumers $26 billion since the president was inaugurated. We continue to improve transparency by gag clause legislation that prevents PBMs and insurers from telling pharmacists that they can't inform patients of the lower cost alternatives for their drugs. We're continuing to drive forward on our efforts to end foreign free riding, the proposal that we've got there, and we're looking at even more options. And as I said, we're willing to work with Democrats and Republicans. Anything that keeps the patient at the center and keeps our drug supply safe is on the table, and we're willing to work to bring those prices down.
Yeah, but I mean, you walk this balance of making sure that the prices of drugs, prescription drugs, are accessible for people, but at the same time, you're not impacting the idea that private investors want to invest in this and create innovation, right?
Well, there's tremendous innovation out there right now, and we approved, in fact, 59 new molecular entities and biologics just last year at FDA. So tremendous innovation is occurring. We're certainly going to do nothing that impairs innovation, but there is a lot of reform that can happen that doesn't in any way impact innovation. We're investing close to $40 billion a year at NIH. The pharmaceutical industry is investing $70 billion a year in R&D. So there's a tremendous amount already happening there, and for some savings that could accrue to patients' benefit, we can still preserve all incentives for innovation.
Secretary, let me go back to the shutdown, because we're getting a lot of mail from viewers, and they're worried about the quality of food. If the shutdown continues, some food bank officials are saying that it could hurt people like, for example, seniors. What are you doing specifically in terms of making sure the quality is where you need it to be, even in the face of all of these employees that are not on the job, and even furloughed workers who are coming back are not getting paid?
Well, that's really a testament to the dedication of those FDA workers who are willing to come back to protect America's food safety and medical and device safety. And so we're very appreciative to them. And like I say, we have the authority to have our food inspections continue to protect the highest risk food products.
It is affecting food stamp recipients as well.
Well, I'd have to defer to the Secretary of Agriculture on that.
Right.
For us, our role is really that food safety, and we're gonna keep inspecting the highest risk areas.
Secretary, thank you. We will see you soon. Secretary Alex Azar.